Hello there, this is Dr. Mintz. This is a chest radiograph I encountered earlier this evening. It demonstrates a few interesting things. First of all, the ET tube tip is below the level of the thoracic inlet, and that's good. You don't want it to be above that level. You have an IABP, intra-aortic balloon pump catheter, that's coming from down below, and this is used to help cardiac patients perfuse the heart, and it's actually a long balloon that inflates inside the aorta during certain phases of the heart contraction. But it's important that this be below the level of the distal aortic arch, so the aortic arch kind of goes like this, so you want to make sure it's below the level of the aortic arch, and this is. Now I hope you can see this, but some of the lines here are prominent and some of these are vascular, and it's kind of experience that will help you learn what's vascular and what's not, but the fact that they taper a little bit suggests that all of this busyness in the hilar regions is congested pulmonary vasculature, probably pulmonary veins, because the return is impeded by heart failure. So the heart is not able to get rid of the blood as fast as it needs to, and so there's a backup of pressure. So that can produce the pulmonary venous congestion. And it's seen in heart failure often. We also talk about cephalization of blood flow because it preferentially involves upper lobes. What's interesting about this case, though, is if you look right here, this is the location of the arch of the azygous vein. The azygous vein starts down low, courses in the right paraspinal region, and then curves up over the right mainstem bronchus as the arch of the azygous vein, and it looks usually like a little lentiform, lens-shaped thing right around here, right immediately superior to the right mainstem bronchus. But this looks giant. I've never seen one like that. So to me, that suggests that the patient probably has right heart failure, because this is systemic return, which needs to go to the right atrium and right ventricle. So if the patient has right heart failure, it means the right heart can't pump out well enough, so there's back pressure from the right ventricle to the right atrium, and then in turn from the right atrium it will affect the SVC and IVC and delay the flow, the entry of blood from the SVC and IVC into the right atrium. And the azygous vein is just one vein that empties into the SVC at this level, and you happen to be able to see it. So this is very unusual. I think it's the first time I've really seen that, if that's what this is a very prominent azygous vein, specifically the arch of the azygous vein there.